I really believe that as a physician, as a family doctor, by sort of training and practice over many years, that when you don't have finances as a part of the relationship between the doctor and the patient, and when you move a third-party payer into the process, you remove the financial transaction between the doctor and the patient, that what you actually do in removing the finances is that you remove the relationship in most cases. Let me briefly explain what I mean. So I don't want any of this to sound in any way sort of confusing or highfalutin. I mean that in England, as I looked at how most family doctors looked after their patients, and I even saw these attitudes absolutely beginning to grab me, there were times where I almost despised my patients because they were coming with such trivial, nonsensical things, and they were wasting my time. Now, would I have felt that if they had been paying me? No, I would have listened. If she wanted to talk about her cough or her cold and felt it was worth coming to see me, and there had been some sort of financial transaction, I wouldn't have been tempted to move, I think, in that sort of direction of thinking like this is a waste of my time. Okay, there is something about building mutual respect in the actual transfer of economic value that says that the patient values me and I value them. So, I could jump to an article I read just the other day. I think it was in the New York Review of Books. And the writer, he's a historian by background, but he was describing his recent experience of the medical system. And he said this, and I was really grabbed by his remarks. We would like to think that we have health care that incidentally involves some wealth transfer. What we actually have is wealth transfer that incidentally involves some health care. And he went on to talk about his relationships with the doctors and all the things that went wrong. And one of the main things that went wrong is that whenever he was talking to them and he needed their full attention, they were looking at their computers or they were answering their cell phones, and what was going on with him wasn't important enough because there was no real understanding in the doctor-patient relationship that the doctor was giving their best to him, which probably would have meant that all of the things that went wrong wouldn't have gone wrong, and he was giving his best to them in terms of the economic transfer that was going to happen. So to me, the doctor-patient relationship is actually at the center of what we're describing here in terms of medical entrepreneurship. It's central because actually in healthcare, you basically have two sides. You have the patient and the physician. Now, I'm not saying that there isn't room for all sorts of other things. I'm trying to keep this really simple this morning. So please, if you happen to be a nurse or, maybe a technologist or an insurance broker or whatever it might be, I'm not saying that what you do is not important, but I'm saying when we look at healthcare, we're thinking about sick people, typically. That in itself is a problem. That's actually a sickness system rather than a health system. It'd be really nice if we began to think in terms of health care in such a way that the emphasis was before the illness to prevent the illness as much as possible. But, again, without going into depth in many of these types of areas, I think it's important that we again put the patient as the consumer right at the core of what's going on, and that we create systems that says, Mr. Patient, you're the most important person in this system, because you as the consumer have a need that you want to have met, and we're looking at how we can, through the power of the market, bring the best possible quality of care to what you need. And again, I wish we had time to explore these sort of concepts and ideas, but medicine is really the only thing I'm aware of in the sort of massive economy where in a country like the United States, and it would be true but modified even more in other sort of Western nations that all tend to have some sort of variant of socialized medicine, that in medicine there is an inverse proportion between cost and quality. Okay, meaning that the more you pay, the less likely you are to get good quality. Okay, now this is bizarre, and it's completely misunderstood, not only by most people in the profession, but by virtually everybody involved in medical policy and the consumers, because it's unimaginable. I mean, if I go to buy a car and I have a choice between a BMW or a Ford Fiesta, I understand why I'm paying twice as much for the BMW as I am for the Ford. Okay, that's a choice I understand, and I can make a rational choice. And if I want to and I can afford to spend enough money, I'm probably going to buy the BMW. And that's a rational choice. Whereas in healthcare, if I'm spending twice as much to have my gallbladder removed over here as I am here, I am probably going to get a better experience and a better cost. And if we're talking in terms of Surgery Center of Oklahoma, since we're in this august company today, well, I'm definitely going to get a better experience and a better cost. Okay, now this sounds irrational until you read some other article like the one I read, earlier this week about the doctor at a hospital who was in charge of some of the lab work and stuff, and he needed to get a COVID test, and so he thought, I'm just going to go through exactly the same experience that every one of our patients has to go through. I'm going to, and he was only there on a short-term basis running the lab, and so he actually had a short-term, I'm not sure if it was short-term, but it was an individual insurance policy through Golden Rule, which I think is a part of United Health, if I remember right. So he wanted to experience what everybody else experienced. So he just went in to get a COVID test like everybody else would. Okay, now quite apart from, some of the things he wrote about where, the actual experience was not particularly good, what was most shocking of that experience was this test, which he said he knew that the reagents and stuff to carry out the test were going to cost about $8, that when he saw all the insurance paperwork, including his part, he was charged at $10,900 for a COVID test. And he said the most shocking thing about it all is that his insurance company paid it in full. Now, this is bizarre. I mean, it's beyond bizarre. It's absurd. And it's immoral. Okay, and we need to understand these issues because these begin to drive, in a sense, some of the issues of vision. Okay, so, as I began thinking about what it meant to find a different way to handle healthcare costs, and this has been, sort of a 30-year process while living here, one of the things I began to see is that we're not just looking for something better. We're looking for something different.